chronic pain, the opioid epidemic, and chiropractic's answer to that is what we're going to be talking about. Lots of people have chronic pain. The opioid epidemic is growing and getting a lot of headlines. And so let's move forward and talk about how chiropractic can be a powerful, important ingredient in helping the chronic pain epidemic, the opioid epidemic, and drug abuse, and so forth. So, as we move forward, I'm going to be quoting some research articles that it's going to show you the effectiveness of chiropractic on the pain model, chronic pain, chronic spinal pain, and so forth. So, what I'm going to do is show you the effectiveness of chiropractic on chronic pain. And as we get into this, I want to go over some numbers for you on how people are being affected, how many people are in chronic pain, and so forth. An article that I dug up for you just before I came in was from the U.S. Surgeon General, Dr. Vivek Murthy. And he released this in November 17th of 2016 from the National Library of Medicine, declaring war on addiction. And he said, we have 20.8 million people in America with substance abuse disorders. There's strong evidence that prevention and treatment work. Prevention and treatment, that sounds like a chiropractic model to me. Let's prevent things so we don't get into this drug epidemic and opioid epidemic and so forth. Addiction specialists applauded the Surgeon General's report, stating that addiction is a disease of the brain that can and should be treated with evidence-based, compassionate care. And that is so fantastic. That's exactly where chiropractic fits for people. It's a non-drug model. It won't work for everybody, but it's a non-drug model. It is effective. We'll get into that. And that was stated by Dr. Jeffrey Goldsmith, president of the American Society of Addiction Medicine. That is fantastic. So, let's talk about some numbers here. I've talked about this on the show. These are the best numbers that I have for you just to wrap our head around chronic pain, the opioid epidemic, and where chiropractic fits in this. 614,000 people a year die from heart disease. These are 2015 numbers. 591,000 people a year die from all forms of cancer. The third leading cause of death is medical care at 546,000 people a year, which would be equivalent to 21 jumbo jets full of people going down every week. Big number. Out of that 546, 440,000 people a year die because of medical mistakes. And included in that, 100,000 people a year die because of infections that they get in a hospital. Hospital-acquired infections, okay? On top of those numbers, again, is the 106,000 people a year number. That's the number of people in a hospital setting, follow me now, follow me, that take the right drug for the right diagnosis in the right way, which means no mistake was made and the medication is what tanked them, okay? So that's what we want to wrap our head around. The number is that number. Taking a look at the next slide, if we could, is we're looking at now pain drugs, okay? So pain drugs, non-steroidal anti-inflammatory drugs. Those are the ones that we know over the counter, which are the ibuprofen, the naproxen, Aleve, aspirin, and so forth. Those are the over-the-counter medications, okay? The prescription medications, Celebrex, diclofenac, which is Voltaren, and so forth. These here are all the non-steroidal anti-inflammatory drugs, okay? 16,500 people a year die because of that. We've known that number since 1999, and that's considered a conservative number, okay? Now, a lot of us think of these drugs like the ibuprofens and the aspirins as they're safe, no problem, go to the store, buy some this week, buy some next week, take them willy-nilly because they're not a problem, but there are the numbers. That's a much higher number than a lot of you probably realize. Vioxx, you really need to wrap your head around this. Vioxx killed 60,000 people in 5 years. 60,000. That killed, the drug Vioxx killed more people in 5 years than the Vietnam War did in 10 years. I don't see people protesting out in the streets because Vioxx killed so many people. Maybe we should. That's a lot of people. But that's okay. Celebrex is safe. Well, some people tell me, I don't take any of those drugs. I take Tylenol. I take acetaminophen. That kills 458 people a year. And as you've heard me say in prior shows, there are some other issues with Tylenol. Now, we're told that if you need some pain control, Tylenol is safe during pregnancy and safe for younger children, right? Well, I have 5 good studies here that indicate Tylenol and acetaminophen increases the risk of autism and autism spectrum disorders. Didn't know that, did you? One of the studies says, evidence that increased Tylenol use in genetically vulnerable children appears to be a major cause of the epidemics of autism, attention deficit with hyperactivity, and asthma. And this study indicates that our rate of autism in the United States is 298 times that it is in Cuba. Now, Cuba is a highly vaccinated population, just like we are in the United States. What's the difference, says this study, is we regularly give Tylenol to kids after their shots to take care of and handle some of the pain from the shot itself. So there are serious issues with any of these common and considered safe medications. We need different answers. Now, opioids, let's talk about just opioids for a moment. 47,000 people a year die from drug overdoses, and these are 2014 numbers. That number is rising, and it's driven in large part because 19,000 people a year are dying from prescription opioids. I told you the prior numbers because it is 19,000, but there are other numbers that are much, much larger, right? This number, 19,000, has been up 3.4 times since 2001. So there's many, many more people dying of opioid overdoses now than compared to 2001, 3.4 times. Just so you know, the opioid drugs are the oxycodones, the hydrocodones, the codeine, the morphine, and fentanyl, among others. Okay. Some opioid statistics that I wanted to bring up to you. This is again from the American Society of Addiction Medicine. Of the 21 million Americans 12 or older that have a substance use disorder in 2014, 1.9 million have a substance use disorder involving prescription painkillers. So 2 million people a year have prescription drug problems. And of that, 586,000 as a comparison have a substance use disorder involving heroin. It's an estimated that 23% of individuals who use heroin develop opioid addiction. So you can see that cross integration that happens, which has been all over the media and so forth. Okay. So on the next slide, how do people end up getting chronic pain? That's the next thing that we need to talk about. Okay. So one of the ways that we do it is with car accidents. Not the people, unfortunately, that die from car accidents, which is some of the numbers here. And you need to know these numbers. In 2015, 38,000 people a year died from car accident injuries, fatalities. The reason that number is so significant is it's up 8% from the year before. Up 8%. And that is the worst increase in car accident deaths for 50 years. That's a huge increase. Well, unfortunately, in the first half of 2016, we are up even another 10%. Those are the deaths on our roadways. And again, I don't see protests and marches for these kind of numbers, and there probably should be. In 2016, it is now estimated we're going to see 4.4 million people injured from car accidents. Many of these people will develop chronic pain, and that's a serious problem because they might feed into over-the-counter medications and then prescription medications, possibly opioid medications, maybe heroin down the road. And that's a problem. We need solutions for these people. So another reason that we have people with chronic pain is military injuries. 1 million military people have been injured in the Iraq and Afghanistan wars since 2001. 1 million injuries. 270,000 of them have brain injuries. 300,000 of our military folks have post-traumatic stress disorder, and a lot of them need help. This is an article that I pulled off of Forbes magazine. It's by Rebecca Ruiz, November 4th of 2013. So this article is now 3 years old, but I thought it was fascinating and we need to know this. The International Business Times reported Friday that the Department of Veterans Affairs has stopped releasing the number of non-fatal casualties in the Afghanistan and Iraq wars, thus concealing what the paper called a grim milestone of 1 million injuries. These military people need help. And a lot of the information that's out there indicating that they get also, some of them get hooked on these prescription medications. So they need other ways of dealing with their chronic pain. Chronic pain numbers. 100 million of the people in the United States, 100 million adults, have chronic pain. That's 1 out of 2 adults have chronic pain. 1.5 billion people worldwide have chronic pain. And what is the number one spot? The number one spot of pain anywhere in the body is the lower back. It is the lower back. Well, that's kind of good news too, because in a moment I'm going to share with you how super effective chiropractic care is for acute low back pain, chronic low back pain, also neck pain, and low back pain being the number one source, or number one body area that has chronic pain. Now, another reason that people feed into the chronic pain pool, we've talked about car accidents, we've talked about, unfortunately, military injuries. Well, the other one is the obesity epidemic. The more obese we get, the more we're fueling our chronic inflammation and, of course, our chronic pain production. Okay? We've gone over the statistics in obesity before. 10% of people in this country were obese in 1960. That went up to 15% in 1990, so 30 years later, 15%. 2013, it went all the way up to 36%, and now the numbers are 72%. 3 out of 4 adults in this country are either overweight or obese. And when we are that way, we're going to increase our inflammatory markers, we're going to have blood sugar dysregulation, our insulin goes up, our chronic pain chemicals in our body go up, which will lead to chronic pain. So we have to solve that now too. One spine and one brain. Why do I have this on there? So we need to start wrapping our head around, where do we get chronic pain? Chronic pain is in our brain. That is our perception of pain and suffering, if you will. So if we can improve our brain activity and function, we're going to be able to reduce, at least in some people, probably a great number of them, we're going to be able to reduce the chronic pain. What is the number one input into our brain that makes our brain work and work better and more efficiently and allows it to concentrate better, develop better, have better growth activities in them, helps our children, as we talked about autism and ADHD in the past studies. What's the number one input to that? It's the spinal nerve endings in and around our spine. Our brain and our spine are connected together, and they will be intimately forever. That means the better our spine is from an alignment standpoint, a posture standpoint, a flexibility standpoint, that means our brain works better. And of course, if we're taking better care of our spine, we're going to deal with the chronic pain spots, which is our neck and our lower back. If the spine falls apart and the brain falls apart, that's it. I mean, that's our entire life. When should spinal care begin? As the twig is bent, so grows the tree. I always propose to people that spinal care should begin as children, as infants, because that's when our spine is there, and that gives us our best ability to make sure our spine stays well for the rest of our life. When should dental care begin? Of course, everybody says when we have teeth, right? Well, I propose that our spinal care should begin early on. And that allows us to teach people how to take care of their spine as time goes along at an early age. Oftentimes, many people don't even know how to take care of their spine until they get older with chronic pain, and then they come into my office or other chiropractic offices and so forth. And then we start to show them how to take care of their spine, and they would often say, gee, I wish somebody showed me this years ago. A strong posture, a healthy spine, a better brain, and we get a better quality of life with less pain. More on that as we move along. Chiropractic effects. I'm now going to get into how chiropractic can help you, and it can help all of these people, 1 out of 2 adults in this country, that have chronic pain. There's evidence that chiropractic can help children and adults with bedwetting. Why would I talk about that with chronic pain? Because I'm showing you that there are visceral effects by working on the spine. Visceral effects means that we're having effects on the sympathetic nervous system. The sympathetic nervous system is part of your autonomic nervous system, which has far-reaching effects on organs, blood flow, and all of those chemicals that regulate pain. So if we can demonstrate effects on systemic activities and organ activities, we can have effects on blood flow and reducing pain inflammatory chemicals and so forth. So we have evidence that chiropractic helps with bedwetting. We have research that chiropractic helps with ear infections. We have an article you're going to see later on that we have blood to the brain is improved after chiropractic adjusting of the spine. We have 2 fantastic studies that show that chiropractic significantly reduces blood pressure. So as we're working on the spine, we're decreasing the sympathetic outflow. That's relaxing the heart, that's relaxing blood vessels, improving blood flow, which is going to improve blood sugar regulation, decreasing inflammatory chemicals, decreasing insulin, and so forth, which has the potential of decreasing chronic pain. This article here I like. Again, it's talking about more of a visceral standpoint, but it's talking about systemic effects by improving spine, will improve the brain, and improve our organ system, which have a chance of reducing chronic pain. Again, an article out of Forensic Science International in 2002. This was a study about sudden infant death syndrome, linking it to misalignments in the upper neck. And so what it was for was chiropractic adjustments for posture, motion, cerebral disturbances of motor patterns, sensoromotoric disturbances, colic, hyperactivity, and sleeplessness. That's affecting basically all organ systems. And on the next slide, you'll see that from a safety standpoint, chiropractic adjustments were the most successful therapy for all of those conditions I just mentioned. 20,000 treatments without serious complications, speaking about safety, chiropractic being extremely safe compared to all those medication statistics I shared with you earlier. Children with disturbed symmetry. What is disturbed symmetry? It's misalignments. And the worse the misalignments are, an increased chance of sudden infant death syndrome, which means what? That's affecting brainstem elements that affects your heart centers and breathing centers. It's all tied together. There's our visceral system being tied into the condition of your spine, which has relationships to chronic spine pain. Chiropractic in children, again, just talking about those visceral components so you know the effects of dealing with the spine. Safety, here's another one, 5,200 adjustments, no serious adverse effects. Nursing dysfunction, children having problems with nursing, 2 to 5 visits to a chiropractor, most of them are nursing fine. Colic and long-term colic, great improvements with chiropractic care. So again, it's showing that chiropractic can help these visceral systems. Chiropractic for pain. Now we're going to go head-to-head. We're actually going to show the effects of chiropractic on pain, acute pain, chronic pain, and we're going to go head-to-head against medications. So we're going to show you, and we're going to show the world, and we're going to show medical insurance, and we're going to show our legislators that chiropractic should be included in all of these systems so we can reduce the dependency on opioids, over-the-counter medications, and all the side effects that occur. First study, in 1990, out of the medical journal, The Lancet. Strong, clear advantage for chiropractic patients over hospital care for low back pain. Sustained improvements 6 weeks, 1 year, 2 years, and even 3 years after the care is over with. So not only was there improvements early on with the chiropractic care, but there were sustained improvements, and the best improvements was for what? Chronic pain. On the next study, this is moving forward in 2003, chiropractic, there were 3 groups on this one here. There was a chiropractic group, there was an acupuncture group, and there was a drug group. Okay? 9 weeks of care. Now, these people had years of chronic pain. They either had 6 years of chronic pain or 8 years of chronic pain. Everyone was randomly assigned. It just so happened in this randomness, the chiropractic group had the worst of the worst. After 9 weeks of care, just 9 weeks of care now, there was some relief in the drug group at 5%. There was relief in the acupuncture group at 9%. 27% of people in the chiropractic group had relief of chronic low back pain in only 9 weeks. Adverse effects, there was 6% adverse effects in the drug group, and there were none in the chiropractic acupuncture groups. This was amazing, though. Improvements in general health status. Not only were people reporting on their pain, they were saying how great my life is after this. Improvements in the drug group and the acupuncture group were there, but 47% of people reported my entire general health status is better, not just my chronic pain. 1 year later, all of these groups were followed up on with no additional care. 1 year later, followed up. 5 of the 7 outcome measures that they were using were still better a year later in the chiropractic group, with only 1 of them in the drug group was still better. So we're seeing an effect, a long-term effect in chronic low back pain people even a year later after treatment is over. Another study here, this is now for acute low back pain. Chiropractic went head-to-head against the non-steroidal anti-inflammatory drug Voltaren. And the conclusion was the chiropractic adjustments were significantly better than the drug, and what's also important for you is significantly better than the placebo. So we had a drug group, we had a placebo group, and then the group that received the chiropractic care did much better. Next one. So chiropractic for long-term low back pain relief. This was a great article out of the Spine, the journal Spine in 2011. What they were doing in this study is seeing, okay, now we're showing that chronic low back pain responds really well to chiropractic care, short-term and long-term. Acute low back pain, definitely better than medication, also responding well. So how good is chiropractic wellness care, chiropractic maintenance care? And this study said, we're going to do chiropractic adjustments twice a month for 9 months. Another group is going to receive fake or sham adjustments. And the last group is going to get worked on for a month, and then we're going to stop, okay? The maintenance chiropractic people had less pain, less disability, and a better long-term benefit. So that again tells us what chiropractors have been talking about for 125 years. It says, not only do we want to work on you until you're doing better, we want to make sure that you stay that way with maintenance care, with oil changes, with tune-ups, with rotating the tires around the car. Blood to the brain, I mentioned this earlier. It's important that the brain activity gets better because that's the centers of everything. That's the centers of suffering. But if we get the brain better, your world is better and your pain will potentially drop. Chiropractic adjustments for neck pain. They did scans of the brain pre and post, and they found that we had increased glucose metabolism, which means increased blood flow, lower stress, lower pain, less muscle tension, lower salivary amylase, which means less stress, and better quality of life from chiropractic care in the neck, showing the changes in the brain. We're getting systemic effects, and that's why chiropractic needs to be included with all of these healthcare systems if we want to help the 1 out of 2 adults that have chronic pain. Back pain in your brain. This study says the more back pain you have and the longer it is, the volume of your brain, the brain actually shrinks in size up to 11%. Although it's reversible, what a surprise. You work the spine better, you're going to start growing that brain back if you take care of the source of chronic pain, which often cases is the lower back. Cervical curve posture. Now we're looking at the neck. We know that the neck is supposed to have that nice curve in it. This study says if you have no curve in your neck, you have an 18 times greater chance of having neck pain. Okay? A goal should be maintaining the healthy curve and posture of your neck. And you'll see on this next slide that text neck is one of the reasons that we all get messed up, right? Having our head like this 12 hours a day in teenagers now, doing this kind of stuff where that heavy head is forward. And if a 13-pound bowling ball is forward at 15 degrees, 30 or 40 or 45 or 60 degrees, The 13 pounds now multiplies into 27, 40, 49, even 60 pounds of relative pressure, stress, aggravation on your neck joints and your back joints, which leads you to more chronic pain. This is what it looks like. We've all been here. I mean, we all have sit-down jobs now. We're all pounding away at a computer, whether it's the cell phone or the computer like this, and that's just going to mess us up even more. Poor posture predicts mortality. Scientists have now shown us that the more forward we are, the more slouched we are, we actually will die sooner. We lose years off of our life, and we also lose quality of life. The more forward you are, 144% greater chance of death, 2.4 times chance of atherosclerosis, clogging your arteries, just from poor posture. So the more hunchback, more chance of death. Not only chronic pain, you shorten your life. Chiropractic for the military, as I touched on. The good news is we're starting to integrate chiropractic into VA facilities. We're starting to integrate chiropractic onto active military bases. And this is all happening now. Back in 2015, the Senate passes a bill to expand chiropractic services at major VA medical centers. And one thing I want you to do is watch the movie called Escape Fire. EscapeFireMovie.com, I believe. Fantastic documentary movie about the medical care system, how it's not working and how it can work better. And in there, they were talking about these vets coming back with chronic injuries and taking medications and so forth, but how acupuncture and meditation was working better to help them get off all of their medications. The Department of Defense has chiropractic on 60 bases. VA facilities, it's beginning to increase, and they want chiropractic at all the VA bases because it's working. If you want more information about how to access chiropractic, if you are active duty military or a vet, or your family, or if you're a survivor, here's some sites for you. PatriotProject.org is one way to get there. Yes to Chiropractic.org has a military page. Our chiropractic organizations have some information for you. The American Chiropractic Association, the International Chiropractic Association, and I'm in Massachusetts. Our Massachusetts Chiropractic Group, masschiro.org, has information as well. What do you do moving forward? Here's your plan. Start with your chiropractic care. You can see there's plenty of evidence. We talked about evidence-based, compassionate care for people to try to get them out of chronic pain. Go to my website, watch my show, go to my YouTube page. Plenty of information on how chiropractic can help you, your spine, your brain, your organs, help people come from chronic pain to non-chronic pain. I have stories of people that have had chronic pain for years and how to get that better. Clean diet and drinking only water. Get off the sodas and diet sodas. No juice, only drink water, flavor it on your own. Don't buy anything that has flavor, just drink water. If you want one thing to do that's going to help you, no fruit juice. Eating a cleaner diet will decrease inflammation and decrease chronic pain. You want to get exercise to your tolerance. You exercise your body in the best way that you possibly can to your tolerance, to your ability, and get help. And that includes exercising your spine. I've talked about that on this show. I've talked about that on my YouTube page and on my website. Exercise will help decrease chronic pain. Sleep. Most people don't get enough sleep and enough restful sleep. We talk about that on videos here and on my website. I have an instrument that you all need to be reading about. I have a laser. It's a therapeutic laser. It's also called a cold laser. You can do Google searches for this. Low-level laser therapy, and mine is from a company called Erconia. This is FDA approved. It's great for chronic pain, and I use it for mild traumatic brain injury. And lastly, you can definitely engage in massage, acupuncture, and reducing stress, because that will be critical in dealing with chronic pain as well. I'm Dr. Scott Fuller. Please join me again.